Coming to you today from One Hit MMA Gym here in Layton, Utah on Fairfield and just off Gentile. And this is Aldo we'll be working with him today. Today we're going to talk about the Glute Max muscle, and I'm going to teach you how to test that muscle and how to assess it. Here we go. When you're going to assess the Glute Max muscle, you want to have the patient laying face down or prone, and then first of all, I like to start off with a little range of motion assessment. Now this is hip extension. Essentially that's what the muscle does, the glute max muscle, is extend the hip. And so you're going to start by placing your hand on the small of the person's back that's being tested, and you're going to pin their low back down to keep that from moving too much. You're going to ask them to keep their leg straight and raise it up as high as they can, so without bending the knee. So without bending your knee, raise your leg up as high as you can. And you're going to look to see how high they can go. And do the other side, please. Okay, and so you're looking for about 35 degrees of hip extension. You'll see sometimes that one side doesn't go as high as the other side, and so you might want to look on that side a little bit more and assess that side. Sometimes there's joints also involved in this. Okay, so right here you have your sacroiliac joints where your ilium attaches to the sacrum, and sometimes if it cannot extend up like this, that's going to be a factor also. But essentially everything has a muscle component, and that's going to be a great range of motion test to assess the glute max muscle. Okay, so next, for the sake of illustration here, we're going to do the muscle test. I'm going to test on this side just so you guys can see a little bit better. Essentially you want to be more or less, you want to be on the same side that you're going to assess. Okay, so if I'm assessing the right side, I want to be standing on the right side. But what you do is you start out by bending the knee like so. You're going to grasp the ankle with two hands. You're going to bring it up to about 35 degrees-ish. You're going to grasp behind the knee with your forearm at a 90-degree angle to their femur bone here. And you're going to give them a command, please resist, resist, and you're going to push. And you're going to hold for 2 seconds. Now, what you'll see if this muscle isn't working, that if you push and ramp, they will drop. All right? If sometimes you'll see you'll push and their back hamstring will cramp up and they'll drop. Okay? You only have to apply 10, 20 pounds of pressure is all. In reality, if the muscle is firing to its fullest, you can lean all your body weight on that, and that muscle is so strong it'll hold you up. So it's very apparent if this muscle isn't working. One thing that you may see is compensation in the body. So if I bring them up and go like this and they roll real hard like this, they're trying to kick in other muscle systems. You can't let them do that. If you got to be true to this muscle test, you got to keep them right in this position where their hips are almost down to the ground or down to the table, applying that pressure like so. So if I were to assess Aldo's muscle here, his glute max muscle, I'm going to assess this. I'm going to ramp my forces within a half a second to about 20 pounds and hold. Okay, so hold this position, hold tight, hold. Okay, so that is an aberrant muscle. Try again, hold tight. And repeat the test 2 or 3 times just to make sure. It might be a warming up issue. You might want to let the person warm up. But that would be, Aldo, that would be an inhibited muscle or a muscle that's aberrant, so we would fix that muscle. Okay, so we did the therapy to Aldo, the A.M.I.T therapy to activate this muscle. So it's only been about 10-15 minutes, and now we're going to retest it right afterwards. And this is kind of what you should see. So let's do it. Bring it up. Now push tight, push, 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 push. Okay, and you can see he held that no problem for at least 3 seconds. Push tight again, push tight, and I'm leaning all my body weight in there, and he has no problem holding that. And so that muscle's intact now, and it will stay that way long term.